I'm Dr. Shawn Tassone. Welcome to Confessions of a Male Gynecologist, a podcast dedicated to women's health and hormones, and pretty much everything else you were never listened to when you went to the doctor's office. I'm board certified in OBGYN and integrative medicine, and I have a PhD in mind-body medicine. I guess you could say I'm a little bit outside of the box. In this podcast, I'm going to get you the answers you probably asked 5 other doctors and were kind of blown off. I want you to know that I'm not only here to talk, I'm here to listen as well. And now, let's get to those confessions. Hey, y'all. Welcome back to another episode of Confessions of a Male Gynecologist. I'm your host, Dr. Shawn Tassone, OBGYN, integrative medicine doctor, author of the Hormone Balance Bible, currently licensed in 47 states. So if you want to see me via telemedicine and I'm licensed in your state, which I probably am, you can call the office at 512-956-0296. Today, in staying with current events, I wanted to do an episode based on this current statement by the administration that Tylenol is a huge increased risk of autism in children in this country. Now, obviously, autism is a huge, huge topic. But this week, the administration came out, Donald Trump, not being political, but he came out and basically stated that Tylenol could be bad. There's a big increased risk of autism and things like that. So I wanted to basically go over this messy headline cycle. Claims that Tylenol in pregnancy cause autism because it renewed basically the chatter about vaccines and autism and the changing of the U.S. vaccine schedule like Japan. I'm a holistic gynecologist. I care about root cause thinking and evidence. So I wanted to separate the signal from the noise so that you can make calm, informed decisions. My ex-wife is a OB. She still does OB. I haven't done OB for probably 7 or 8 years. And I just texted her and I said, I would hate to be you this morning, the day after it happened, because the number of phone calls they were going to get, women who were probably 7, 8 months pregnant, who had taken Tylenol, women that just delivered that had taken Tylenol, and they're worried about autism. So you have to remember, one of the things that autism is being diagnosed at an alarming rate. And if you look at my generation, when we were in kindergarten and through first grade, probably in the mid 70s, late 70s, and even early 80s, autism wasn't diagnosed really. I mean, kids had ADD maybe, but even that wasn't really diagnosed. We just thought, people were different and they had different studying methods and they didn't like to interact or whatever. But autism wasn't as big as it is today simply because the diagnostic criteria were not the same. So when people say there's this massive increase in autistic diagnosis, it's true, but that's because the criteria has now also developed, and it's also so wide now because autism is now being touted as a spectrum disease. So even people that might have just mild attention issues or interaction issues might be labeled as on the spectrum. So you have to keep that in mind. Now, that's not to say that the autism rates aren't higher. I'm just saying that that you can't just look at the number, as is with science, and say, oh, there's this reason. What autism is a neurodevelopmental spectrum, early brain development. There is some strong genetic component to that. 1 in 31 people in the U.S. Of 8-year-olds was diagnosed. This is a high prevalence rate. Now, the other thing that clouds this muddy water is that many, many years ago, there was a study that came out in the UK that linked vaccines to autism. There have been large, well-designed studies and major reviews that found no causal link between childhood vaccines, including MMR and thimerosal, which is the dreaded mercury that we hear about, and autism. Now, there is a lot of obvious distrust in the medical system currently, with good reason, because of COVID. This only fuels the fire for people that are creating fear. And I don't think we necessarily know the whole picture. I don't think we have a yes or no. So there's always possibilities. I'm just here to try and make you think a little bit. The Wakefield paper, Wakefield was the doctor who published the study on autism and vaccines and said there was a link. Well, Wakefield has subsequently retracted the paper. Multiple replications of his study have failed, meaning they couldn't reproduce. And that's one of the things with science is it should be reproducible. And Wakefield largely became a pariah in the medical society, lost his license. He made a resurgence, conveniently enough, during COVID because of all the distrust in the medical system. But his paper has been debunked many, many times, even by himself. He was delicensed in the UK, and there have been a lot of studies that have rebuked it. Now, you could say, well, that's just big pharmacy, all the money that's, and I'm not negating that. But what I find funny is that whenever I'm online and I'm talking to somebody about another issue and they're taking offense to the fact that I'm negating what they're saying, they will always go to, well, go ahead and just get your vaccine then, doc, or take your next jab, or how many jabs did you prescribe? They always fall back on vaccines, which I think is funny because I've never in my office given a vaccine, never, ever. I am vaccinated because I had to be, or else I couldn't do my job. And when COVID came out, I did the first three shots. I ended up having COVID 5 times. Just recently, even this year, I had COVID. I don't get the boosters anymore because I don't feel like it really did me any good. And I'm not really in a high risk group. So I do think that there's a lot of fear. I think there's a lot of mistrust. I think that whenever somebody says autism, people's ears perk up. Obviously, there's a lot of parents out there dealing with it. And like I said, there's a lot of people on the spectrum. I mean, how many people in my generation that are in their mid to late 50s might be autistic now with these new diagnostic criteria? And we just thought they were, quiet geniuses walking around. Officials recently made public claims against suggesting that there's a vaccine autism link. This is generally negated by the medical community, mainstream medicine, obviously. There are people out there pushing their own agendas in medicine, but more so, I believe, outside of the medical community because they're trying to make money off of fear. And this is a big thing because they know people distrust the medical system. It would be easy for me to be this pariah that goes out there and says all these negative things about hormones and scare women. And I have a $6,000 program where I could make your menopause or perimenopause symptoms better without hormones because hormones are horrible. And I could say all these things. And I could probably make millions of dollars doing that and then retire. But physically, for me, I wouldn't be able to sleep with myself at night knowing that I was spreading that type of misinformation. So you have to kind of present this data or this podcast and listen to it with the libertarian view of being kind of somewhat moderate. I know it's highly inflammatory. I think one of the reasons that RFK really made a huge surge during COVID was because of the moms, the crunchy moms, as they're being called in the media, who have always been against vaccines and against public schooling and have homeschooled. And they gained a lot of traction, and there's absolutely nothing wrong with any of that stuff. It's just that because those women became more vocal, they were able to get RFK into office. And I don't think that's necessarily a bad thing. Actually, I was on the RFK bandwagon when he was running for president. I think that we can look at extremes on either side and figure as reasonable humans that the answer lies somewhere in the middle. The answer to this is not going to be no vaccines. I mean, people in my generation, again, we received a vaccination called smallpox, and it would go in your non-dominant arm usually. And what it did was it gave you this really localized reaction of smallpox. So you'd get these blisters, this big scab, and then we all have this scar on our left side. So if you want to know how old someone is, look for a little vaccine scar on their left arm or right arm, and that will tell you they're probably in their 50s, just in case, let's say you're on a date, you need to know somebody's age and they're not telling you. The younger generations, like my kids, didn't get smallpox, and there's a reason why. Because it was gone, because we eliminated it, and hundreds of thousands of people died from smallpox back in the early 1900s, late 1800s, and then the vaccine eradicated that. So there are some good things that come from vaccines for the public at large. That's not to say that there aren't people that get vaccine injuries. Of course they do, just by the sheer fact that any medication can have side effects. But I didn't really want to go off on vaccines because I'm kind of middle of the road on those too. But I would say if you're worried about spacing out vaccines, combining vaccines, the ingredients that are used, just bring your concerns. Let's personalize things with the evidence so that your child stays protected. And honestly, what it comes down to for you is what you think is the best for your kids. It's not me telling you, it's not the FDA telling you. I think when they keep you out of school because you don't have the vaccine schedule, I do believe that's a little bit ridiculous, because theoretically, the people that supposedly are at risk are the ones that don't have the vaccines. So it shouldn't matter to the public at large if 90% of the people want to vaccinate their kids and 10% don't, or whatever the number is. The 10% that don't theoretically would be the ones at risk. So why the people that are getting the vaccines care, I don't know. So that's another discussion. Tylenol or acetaminophen in pregnancy and autism, what does the data show and what doesn't it show? What started this concern was an observational study that included blood biomarkers that showed an association between higher acetaminophen exposure and a late ADHD diagnosis. But association is different than causation. I've talked about this a lot. There is an association of people who drive cars have more car accidents than people that don't. Is the car the reason for the accident? No, it's associated with that, but it's the person driving, obviously, and the conditions. And there's all these other factors. But obviously, people who drive cars have more car accidents than people that don't. So you can see where the association is there, but that's different than cause. The biggest, most rigorous update, a 2024 Swedish sibling-controlled study that looked at 2.4 million children, found no evidence of increased risk of autism, ADHD, or intellectual disabilities with acetaminophen use in pregnancy when the family factors were controlled. The NIH reinforces this study. That was 2.4 million people, 2.4 million children. So what happened was the study that recently came out that President Trump was talking about was a recent study that was published, and they make it sound like it was this huge number of children that were affected. But basically what they found, in no uncertain terms, was an increased risk in autism, but the increased risk was 0.09%. Well, that's not many people. How you can come out and make a statement that there was a 0.09% increase blows my mind, that you would make the statement that Tylenol is bad when you're pregnant. Unfortunately, I have a feeling this is going to spiral into a massive class action lawsuit for the manufacturer of Tylenol. Now, that's not to say that Tylenol is a great medication. I personally never use it, but you can certainly hurt your liver if you take more than 2,000 milligrams a day for a couple weeks. It's not a benign medication. There are many medications out there that are like that, but it's a medicine. Just because something's over the counter doesn't mean per se that it's technically safe. So where does the consensus sit right now? The World Health Organization and many experts say that evidence for a causal link is inconsistent Standard guidance remains use if medically indicated, lowest effective dose, shortest duration, which is how we should always treat things. And in most cases, if a woman has a fever and she's pregnant, we don't usually get concerned unless it's around 103, 104 persistently. Fever is showing you that your body's immune system is responding to something, a bacteria, a virus. And usually fever is a good thing. People say it burns out. It doesn't burn out the virus. Basically what it is, it's the reaction to your immune system killing the virus releases some of their proteins, and that causes your body to respond with a fever. But it's not burning it out. That makes it sound like the higher your fever, the better, and that's obviously ridiculous as well, because pregnant women can cause damage to their children if their fevers are super high and they're not taken care of. So it's definitely something you need to look at. Why the headlines are so confusing this week is that political statements have outpaced the science. Multiple outlets and medical groups push back. Even the American College of OBGYN posted something about how they did not change their views based on this study. And again, you can use Tylenol in pregnancy, smallest dose possible for the shortest amount of time. And unfortunately, the government came out and jumped on this. I don't know why exactly. I really don't. I don't know why they felt the need to come out and make this bold statement right off the bat. I don't know if it's because autism is such a huge thing and they want to feel like, they want you to feel like MAHA is doing something, but it's what they did. And now the doctors have to kind of come in and clean up the mess. It's very similar, in my opinion, to the Women's Health Initiative, where they came out and said that hormones were bad. And then we found out that the study was total garbage and all these women that went off their hormones, and now women can't get on hormones because of this fear of estrogen. So take that for what you will. What's the new U.S. vaccine plan and the Japan comparison? Well, what's being proposed in the U.S. headlines is a call to space out childhood shots. So meaning don't give kids all these vaccines at once. And I think, that sounds reasonable to me. You're really overloading their immune system when you give them like 8 vaccines at once. Measles, mumps, rubella is all in one vaccine. I think there's a call to maybe separate those, space them out. It makes sense to me that if you're loading the child with all these injections, that they could have cross reactivity and things like that. Also dialing back the recommendations for low risk groups, particularly around COVID. Despite prior evidence-based schedules, which obviously, in my opinion, were probably totally garbage, the policies are changing. The experts are openly diverging from the federal rhetoric. I think the doctor groups are going to come out in the next few days and really debunk most of this stuff. The question is, who do you then believe? Because not only is there mistrust in the government, there's mistrust in medicine. These social constructs are now going to be, bashing heads together. So what do you do? I think, you can look at it like this. And I agree with Trump on this point. He talked about hepatitis B. And he made the comment that why would you give a hepatitis B vaccine to a newborn baby when hepatitis B is sexually transmitted? Well, it's not sexually transmitted, it's transmitted through blood, it's transmitted through body fluids, of which amniotic fluid is one. So if you have a mother who has hepatitis B, that's one of the things we check in pregnancy, is to make sure you're immune to hepatitis B. But if you are a pregnant woman and you have hepatitis B, you can certainly transmit that to the baby. And so we would want to give you the vaccine to communicate that to the infant, because when it comes through the vagina and with all the amniotic fluid and blood and everything, the baby could certainly get hepatitis B. So I think in those instances, it's probably amenable. Does a newborn baby who's not going to have sex, that has a mother that has no hepatitis B antigen, is that somebody that needs the vaccine when they're born? Probably not. And that's something that medicine needs to recognize. We need to change the vaccine schedule because it may not make sense anymore. So in Japan does vaccinate infants starting at about 2 months on a national schedule. Hepatitis B, rotavirus, pneumococcus, DPT, and MR. It's different in which combinations and when, but there are no shots under the age of 2 months. Japan stopped using MMR in 1993 due to issues with a specific component in the mumps portion. It moved to separate measles and rubella and separate mumps options. Different paths, same public health goal, high coverage against serious injury. The US baseline, the CDC, is built by the ACIP from large safety databases. Combo vaccines are used to minimize needle sticks and maintain protection. Spacing vaccines without clinical justification extends vulnerability. This is what they believe. And I do think that separating, the one downside of separating the vaccines, like the government was calling for, is that indeed the baby's going to get poked more times. If you can give MMR once versus 3 times, that's less needle stick. So that's the other flip side of this, is that you would have to stick the baby more than, the usual amount of times, which is a lot. So what are some practical guidelines for patients and parents? Pregnancy pain, fever plan. Try non-drug measures first: hydration, rest, cool compresses, magnesium for tension. And then if needed, a Tylenol or acetaminophen remains the first line, at least currently, as of the day I'm recording this. ACOG has come out and supported this. Avoid nonsteroidals like ibuprofen late in pregnancy. Document the doses. Loop in your OBGYN rather than just taking it. This trend that's out there right now, just because of Trump derangement syndrome, is that women are now on TikTok taking Tylenol. I just read an article that there's an increased rate now of women having Tylenol complications with ER visits because they're on TikTok taking doses of Tylenol. Again, the stupidity of that, I just don't understand. Just because you may not like the person sending you the message, I just find this ridiculous. I would definitely recommend against that. And then you want to use the lowest dose possible with the shortest duration. So usually we would recommend 2,000 milligrams, no more than 2,000 milligrams of Tylenol a day. So if you want to take 500 milligrams because you feel like you're having a fever, call your OBGYN, get their feedback. The poor OBGYNs right now are getting inundated with phone calls, but talk to your doctor, see what your other options are. If your fever's mild, if it's 100, 101, you may not even need Tylenol. Vaccines for kids: follow your pediatrician's evidence-based plans. If you're anxious, ask about shared decisions, micro adjustments that don't leave big gaps in disease coverage. You can split the vials in maybe to 2 different doses. And then reference sources like children's hospitals, education centers, CDC vaccine schedules. And I say that tongue in cheek because I know a lot of my listeners may not want to listen to the CDC. Unfortunately, I think the COVID thing really crushed the trust in the medical system. I'm sad to say. This is really pushing people to do, things that I wish they wouldn't do. But I totally understand where the stress is coming from. So, rapid fire Q&A. Should I toss my Tylenol if I'm pregnant? I can't tell you that for sure, but I would say based on current guidelines, no, I wouldn't. I would use it sparingly. I would use the shortest duration and I would use the lowest dose possible. I would always recommend you call your OBGYN. Evidence for an autism link is inconsistent, and the largest sibling controlled study that had 2.4 million children found no causal or causal signal between Tylenol and autism. Do combo vaccines cause autism? Again, cause, no. High quality evidence rejects that link. It's been studied extensively. Combo shots reduce the pokes and maintain protection. But again, it's a hot topic, and I'm just giving you the data. Again, in my physical practice, I've never once given a vaccine, even Gardasil, which is for cervical cancer, just because it's just the way that I chose to do things. And it's not right or wrong, but we all have our crosses to bear, as it were, and we all want to do things that we feel are right. I would always recommend you try to get multiple sources, not, Medscape or Google or some of these outliers on the internet, like Dr. Artis, in my opinion, who spreads complete misinformation. And there's always people out there that are going to be dramatic. Drama sells. So they're going to be more dramatic because if they say things opposite of the medical system, they know there's that distrust. Don't get me wrong. These people know exactly what they're doing. They are getting invited on the podcast. Their social media presence is increasing. They're getting more funding. They're getting more dollars. They're getting more sponsors. The whole thing is disgusting, in my opinion. If doctors do that, they make money, they get yelled at. But when these alternative health practitioners create basic misinformation, they make millions of dollars. So take it for what you will. It does sit a little bit odd with me that we put our trust in those folks, but I totally understand why. Is Japan proof that we should delay vaccines? Technically, no. Japan starts their routine shots at 2 months. And these are just differences in policy and procedure choices, not out of autism concerns. This is just what Japan has chosen to do, but we've been seeing that a lot. So holistic care, if you are kind of a holistically driven person, means curiosity and scientific humility. I try to personalize my care without amplifying fear. If today stirred questions, DM me, bring them to me at your next visit. We'll walk through your risks, values, and options. Always find a provider that you feel like you trust, that you hit it off with. If you feel like you're being gaslighted, obviously I would find somebody different. The show notes will have links to the studies that I'm talking about. Basically, what I wanted to kind of close on with this, because I don't want to belabor this, and I think I just like to keep these kind of short and sweet, is that there is no right or wrong answer at this point. There is a correlation that is not cause. The increased risk in the recent study that came out that caused all of the stress was a 0.09% increase. I have no vested interest in vaccines. I make no money off of vaccines. I make no money off of Tylenol or any of the recommendations that I'm giving you. I think we should be more transparent with our funding and things like that. If these people are getting paid by vaccines and whatnot, but please don't come at me online and when I'm besting you in an argument and then say, how many vaccines did you give? Because I'm going to tell you none. And I think that's a weak argument. Whenever you get into a debate with somebody, if you need to revert to insults, personal insults, then you've already lost, because that shows me that that's all you got. If that's all you got is calling me old or whatever, I don't care how old I am. My fiance is gorgeous and she loves me, and that's what matters. And my kids love me. And I would just tell us to be, especially in these times, let's try to be more about dialogue, more about inclusion, and more about just the data that's out there. People don't trust the data because they're worried about who funds it, which is perfectly legitimate. You should always look at who's funding data. But there's a lot of scammy companies out there that quote, they have this study, they have that study, and it might have 30 people in it and they funded it. So always be careful. I'm here if you have questions. Drop a question in the comments, whether it's on YouTube or Instagram or wherever you see this. But keep an open mind to things. Look at the science. Try not to get your scientific education from Google because that's just not good data. Keep in mind that PubMed, whenever somebody says, well, I saw it on PubMed, PubMed doesn't mean anything. PubMed is like walking into a Starbucks and reading a magazine. The studies that are on PubMed, there's good ones, but there's also a lot of bad ones because it's open source, meaning anybody can post a study on PubMed. I can do a study with 2 people and put it on PubMed. That doesn't mean that it's a good study. It just means that it's on PubMed. So take that with a grain of salt as well. Always vet the people that you're listening to. As I said, I'm licensed in 47 states. You can call my office at 512-956-0296. I do women's health and hormones. I also take care of spouses of patients of mine. So if you're a man and your wife is a current spouse or your partner, I'm more than happy to get you going on testosterone or see what might be ailing you. And I'm here. I'm here answering questions. I'm online all the time. I hope you're having a great day, and I hope that this didn't upset you. Have a good one.
Thanks for listening. If you enjoyed this episode and you'd like to help support the podcast, please share it with others, post about it on social media, or leave a rating and review. To catch all the latest from me, you can follow me on Instagram at Shawn Tassone MD, or on Twitter at TassoneDoc, and on Facebook at America's Holistic Gynecologist. If you're really interested in your hormones and you want to do a deep dive, get my book, The Hormone Balance Bible, on Amazon or other major retailers. Thanks, and I'll see you next time.